And then the next thing is that the whole thing about mitochondria and cancer. So the oncogenes, many of the oncogenes, which are the genes that promote cancer, the part of their function is to reduce mitochondrial function, because since mitochondria control programmed cell death, when the mitochondria recognizes that this cell is sick, it will, through its processes, either try to move it to differentiate into a normal cell, or will turn on programmed cell death, apoptosis, and the cell will implode. Right. And so what happens is the cancer cells revert to a more primitive thing. They actually shut down the mitochondria and go back to fermenting, just like the lactobacillus in the sauerkraut. And in doing that, in producing, being in fermenting, producing lactic acid, the lactic acid actually is toxic to normal cells, not toxic to the cancer cells. Okay. And it's also toxic to the immune system. So, and it the acidic state tends to dissolve the connective tissue. So these cancers can grow in a setting where they're suppressing the normal cells, suppressing the immune system, and dissolving so they can grow out. And the fermentation, although it's very inefficient, you get 3, molecules of energy for every glucose. So they're consuming huge amounts of glucose because, that's what it takes. Right. But it doesn't require oxygen. So they can, so if you have a cancer that there's really very low oxygen tension in the middle of the cancer, it doesn't bother the cancer because it doesn't need oxygen. It can live on fermentation. And so, when you do PET scans, a PET scan, which is, looking for metastatic cancer. Right. PET scans measure glucose uptake. And so if you have cancer, what you'll see is this thing is taking up huge amounts of glucose. Now, what you can do is if you reduce the glucose, you're starving your cancer cells. And so that's what we're trying to do, is to starve our cancer cells. And so and the way we do that is to cut the carbs. So eliminate sugar, eliminate starch, and go into ketosis. And when you're in ketosis, as we said, you're protecting the normal cells. You are stressing out the cancer cells because now they don't have fuel. They're already sort of in this primitive state, and they can't grow. And so they sort of die. Even without the mitochondrial function of shutting them down. But in fact, what happens is if you're giving the mitochondria the ketone bodies, if you're in ketosis, right, the mitochondrial function can actually return. And then, so the mitochondria can induce the programmed cell death. So the whole thing works together to stop the cancer. So the worst thing you can do when you have cancer is to eat excess calories and in fact, to eat pasta, bread, potatoes, and rice. And what we need to do is to find out how to not do that.
And I mentioned to you earlier today, I'd seen a TV personality that just this week had a tumor removed from his kidney. Mm-hmm. And they were saying in the report that he had probably had that tumor for 10 years, but it didn't grow because he was on a more ketogenic diet. Right. So I thought that was so interesting because we've been talking about this, right, and then you hear, a famous person that is actually proving that out.
Yeah, and actually, a colleague of mine told me about an acquaintance of his who had a glioblastoma, a brain cancer, that was excised. He treated with radiation, but he went ketogenic for 6 or 7 years. And then he decided, he told his family that, he was tired of living that way and he wanted to go back to eating a more normal diet. And his glioblastoma recurred.
Oh, man.
And he died. And it's like, because in my experiences with patients is the ketogenic diet will control it until it recurs.
Okay.
And then at that point, the cancer, for some reason, can consume anything as fuel. Okay. So the glioblastomas do respond well initially to the ketogenic diet, but they can morph into something else. And I think so. You don't want to give it a shot,
right?
So this is an important sort of daily thing for people who are facing that. And and there are cases where people had a melanoma removed, were living a healthy life, and as soon as their immune system got sort of mucked up, it would just come back. Right. And so all of us are generating cancer cells all the time. Right. And what we want is an immune system that can handle that. Yes. And we don't want to feed it. We want to suppress it. So it's interesting.
Very interesting.
So it and then
here's the example of the keto. I told George that I had a hard time finding a picture of something that would represent the ketogenic diet because everything would have some of the, apples, the higher sugar fruits in it. So here's, a nice salmon on
a nice
some
piece of
leafy
salmon on
greens.
some green leafy vegetables.
Yes.
So and we were going to talk just briefly about those 3 patients so we can do that before we go on to the microbiome transplant. But so the first patient that I saw who came to me, she was in her early 30s, had just had a baby about a year before, and had been diagnosed with metastatic colon cancer. But she, for about 2 years, had been following a ketogenic diet prior to chemotherapy. And she was still on the original cancer chemotherapy regimen 2 years into her course, with clearly what was a very aggressive cancer in this young woman. And she had no side effects of chemotherapy, doing exactly what they had done in that mouse study. Wow. She would measure her finger stick ketones and made sure it was above some threshold level that she had read about. And she had no nausea, no, mouth ulcers, no low blood counts, no white blood counts, no red blood counts that were low, and no neuropathy.
Wow. No
nerve damage. And it's just, and you just thought, this is incredible. That and I asked her, boy, could you write this up? But I know right now what you want to do is spend time with your daughter.
Yeah.
Because so that was that patient, and clearly she was really controlling her cancer, and clearly the cancer chemotherapy was very important.
Yes.
You can't, it's like but you protect your body, and the chemotherapy just destroys the cancer. And usually by now, she would have had some cancer stem cells that would have survived the chemotherapy, and they would have morphed into a resistant strain. But she had suppressed all of them to the point where she was still responding to the standard first line therapy, which was just amazing. And then I had another patient who who's actually a physician in her mid-70s, 76, 77, with lung cancer, sort of a large unresectable lung cancer. And she was starving her cancer. Now, I didn't tell either of these patients to do this.
Right.
They were doing it themselves, and they came to me because they'd heard about me. And they wanted a little validation, I think, that in fact, this was not totally crazy. And I said, no, it's not totally crazy. You're doing what the science supports. Yeah. And this woman said that she had a PET scan looking at was the cancer metabolically active, and the cancer was completely cold. There was no metabolic activity in what it was still a very large cancer.
Yeah.
But there was no sugar uptake. Why? Because there was no sugar. And because she basically was, eating healthy oils.
Right.
And just enough protein to keep her, sort of from wasting away. Mm-hmm. Because, in fact, the cancers can burn glutamine, which is an amino acid in protein. They can turn glutamine into glucose through the pentose, phosphate shunt and stuff. So really, you gotta when you're in ketosis, you can't do it with high protein.
Right.
You have to do it with high oil in that particular case. But she has energy. She's doing stuff. She invited me to a meditation thing for 3 hours, and so that was good. And then I had a patient with breast cancer, metastatic to bone, with high tumor markers.
Yeah.
And so she went on this ketogenic diet again, not from me, but just from her reading, and all of her tumor markers returned to normal. And her oncologist called her up and said, "You should celebrate all your tumor markers for normal." But of course, the oncologist didn't think to ask her, "What are you doing?"
Oh, man.
Because this particular oncologist is a very conventional oncologist.
Right.
Diet, you can eat anything you want, is what they always say. Eat whatever you want, be it tasty cakes or whatever. And so I don't know. So but you see, and you think, okay, but will show us the clinical trials that this works. And the problem is, the University of Ohio started a clinical trial, recruiting a clinical trial of patients with lung cancer and pancreatic cancer, to put them on a ketogenic diet, randomized on ketogenic diet versus standard diet, while they're doing the chemotherapy, during therapy, and they had a total of 7 patients recruited over a period of 4 years. The oncologist would not send their patients, and so we can't study this until. But the hopeful thing is now the oncologists are adding metformin, which mimics fasting and exercise. Metformin is a medication for diabetes.
Yes.
And it actually reduces insulin resistance, and it really does. If somebody's sitting on the couch and they take metformin, they, in fact, it mimics not eating and exercise. Now, and I was thinking, okay, good, I'm going to cheat. I'm going to take some metformin and I'm going to fast it. But there was a study where they took athletes and measured them before and after metformin, and the metformin blocked some of the beneficial effects of fasting and exercise. So you cannot have. You can't double up.
Okay.
So it's just do one or do the other. But the metformin is being added to cancer chemotherapy because the oncologists are beginning to realize that you want to reduce the insulin, you want to reduce the glucose, you want to reduce, you want to mimic this fasting and exercise thing. In trying to do this with patients, my experience has been that when you're given a diagnosis of cancer, everything else stops.
Yes, both of my parents died.
And that you just stop hearing.
Yes.
And that my experience is it's very, very difficult for a person in the midst of the cancer to begin to contemplate going ketogenic. Right. Because it's just too much. Yeah. They're facing chemotherapy. Right. They're facing death. Yeah. And that this is not part of their toolkit yet. And so what I tell people is, now is the time to put this into your toolkit, because we're all developing cancer. Yes. If we are fortunate to live long enough, we will likely get cancer. Yes. But what we want to do is to live with our cancer and have our immune system control it, and for us to starve it to where our healthy cells can beat it. And so now is the time to control your cancer before it controls you.
And the worst that can happen is that you live a long, healthy life and you never get cancer, but
right.
you're healthier.
But you're healthier.
And you have a higher quality of life.
Correct. And I think that it, most people who are doing this, greater energy, improved mood, and just, the reversal of disease. But it takes, it does take a multi-pronged approach. You have to, you still got to do everything, which we're going to talk about when we talk about the blue zones at the end.